Can you tell us some behavioral habits, okay, that can predispose a normal human being to becoming obese? So, like behavioral problems that can lead to obesity.
Okay, thank you so much for this question, and thank you for having me.
Yeah, I love you.
So, behavioral habits that can lead to obesity. So, you know, behind everyone's behavior is the way they see themselves, and the way they feel about themselves, and the respect they have for themselves, like their self-worth. So, how all these ideas you have about yourself is what makes you feel the way you feel and do what you do. So I just wanted to give that context. So if, for instance, you have not so great self-esteem, you don't see yourself like as worthwhile, then it will affect the way you behave. So if someone has been sexually assaulted, for instance, so you have this idea that I actually, unfortunately, I've seen a patient who felt like this happened to me because I'm attractive, because I'm curvy. So she would unconsciously eat so that she would not be attractive and therefore protect herself from things like that. So these are some behaviors that people can, you know, engage in that would eventually lead to them gaining a lot of weight. So using eating to cope with stress and meet emotional needs, and then eating to please, and then eating to make yourself unattractive intentionally.
Right. Thank you for that. You see, you spoke passively or partially about the fact that you're under stress. All of us are under stress, and to be honest, I think I'm guilty about it, you know. Every other person is innocent, but I'm guilty about it. Sometimes you're happy, you got like really great news, you want to like indulge yourself and all of that. And sometimes the good news just keep coming, you know. You could have good news continuously for 1 week and 2 weeks, and then you just and you know, all those calories add up.
Right.
How do you think that people should face this emotional eating? I'm not talking about good news alone. Some people are just stressed, you know. You stress eat, they are depressed, they lost someone and all of that.
Right.
How do you put a stop to that? You know, some people, the way they cope with stress and all of that is by eating. So how do we stop that?
All right, so excellent question. So this is where the entire stress management comes in. So the first thing is to be able to identify you're stressed. Some people don't even know that they're stressed. It's become such a normal thing to them that, you know, they don't recognize it. So recognizing your own personal signs of stress. For example, when I'm stressed, I am easily annoyed. Things that wouldn't faze me before, I might now be yelling and things like that, and I need to tell myself, take it easy. So some people, headaches, like tension type headaches. Some people, muscle tension, they just begin to have like neck pain because of the tension from the stress.
Right.
So identify your triggers, and then, you know, learn other coping strategies. So the eating itself is a coping strategy, but there's so many things you can do other than eat to handle stress. So for example, you can first of all help yourself identify the stress, and then be able to practice something called 4-7-8 breathing. So 4-7-8 breathing is where you take a deep breath for a count of 4, you hold it for a count of 7, and then you exhale for a count of 8. So you can do this as often as you like to, you know, it induces a relaxation response immediately. Something else you could do is something called progressive muscle relaxation. So for those who feel stress like tension, you can progressively contract. So if it's in your neck, you can like hunch your shoulders and really tense it for some time, and then you relax. And you just progressively go down the muscle groups, contracting and relaxing, and in that way you know, release stress. Now these are like specific things you could do, but there are better, like long-term, short-term things you could do to handle stress. I love something called coping ahead. So this is a DBT skill, dialectical behavioral skill, therapy skill, where you anticipate problems that you're going to encounter. Right. For example, you could say, this is Monday, I have a board meeting, I have this meeting or this surgery and stuff like that. This is how it would make me feel, and this is how I've been reacting or responding in the past. Then you could look at those obstacles and prefer solutions before they happen. So you could say, instead of, maybe I could adjust my schedule, or I could take a break in between. So you could cope ahead rather than just heading into the stress. Another thing you could do is accumulate positive emotions. So that means, you know how stress and negative emotions, we take them for granted and they just kind of, you know, come at us. We can actually schedule rewards. We can schedule opportunities for those positive emotions, so that if you are from the get-go intentional about things you bring yourself in contact with, to increase positive emotions, when the negative emotions come, they will not overwhelm you so much because you're like balanced already. Then you can build mastery. So I could go on and on, Dr. Timmy. Should I? I'm just going to continue. I won't let you stop me.
Go on,
it's
go
okay,
on,
because this is all about stress management.
Yeah.
So the B is to build mastery. So some of the things that stress us out is that we feel like we are not, capable of doing what we need to do. In fact, stress by definition is that feeling of not being able to meet up to your expectations or societal expectations or professional expectations, and the consequence of not meeting up is catastrophic. That feeling you have, that is stress. In case you're not in Nigeria, you don't know what's stress.
I'm related to what you're saying because I can personally, maybe I do therapy right now with this.
So when you practice building mastery in those things, so practice it the way you would have like a hierarchy, step by step, and you achieve mastery. That in itself, reduces the stress you feel because you have increased your ability. So that formula I gave you doesn't equal stress anymore. So other than what I've said, another thing to do, we cannot underestimate the effect of lifestyle changes. This is exercise. So I'm not talking about hitting the gym, even though hitting the gym is great. I'm talking about having time in your schedule where you are moving around. So if you have a busy schedule, I would say use the staircase, for example. This is what I do. So I don't take the lift.
Lovely.
So I just go up the stairs. So that is physical activity. So when you're walking, your body is releasing chemicals that are making you feel happy, feel good chemicals, endorphins, and you are indirectly, counteracting that stress you feel. Then other than physical activity, sleep is another entire new, different dimension. Sleep, we now know if you don't sleep, it makes everything worse. Now, I'm not just talking about stress. Now, I'm talking about mental illnesses. Any mental illness that the person is not sleeping, you better get your patient to sleep because that illness is exaggerated or magnified. So I would typically, one of the things, of course, would be to handle sleep. So question you might be thinking is, how many hours do we need? So on average, if you can help it, depending on your age, 7 to 8, 8 to 9. However, we do know that the older you get, the less...
is it 78, 79 hours?
7 to 8 hours.
Oh, I thought you said 78.
Okay. 7 to 8. Oh, thank you for clarifying. 7 to 8. Yeah, no, 7 to 8. 7 to 8. Right. So, yes. So, that's sleep. Then, of course, if you have any illness, treat it promptly so that it doesn't prolong.
Let me cut you short, Dr. Anireto. I'm coming to Dr. Akonde just in a minute, you see. Okay. We spoke about emotional eating for adults. You have all of us. We are under financial stress. If you're in Nigeria, you're under financial stress. You have emotional, physical stress. But what many people fail to think about is childhood experience. So let me give you an example. Right, I had a patient one time many months ago, and the reason she got fat, she got obese, is because she said as a child they had a lot of suffering. There was no food anywhere. They literally starved all through childhood. Now she grew up. She got into some money. She was not like, all the food I did not eat since I was a child, I'm going to eat it now. Obviously, she got obese and all of that. And what is your take on this? I know there are other childhood experiences. I'm not talking from an angle of poverty. I know some people have childhood trauma. Some people have coping mechanism. Maybe they had a bad parental, and then they went to food as coping. As a CBT expert, what do you think we need to be doing to young children? How do we relate to them to prevent them from suffering obesity in the future?
If they have a background of trauma?
Yeah.
Oh. So if someone has a background of trauma, I would say, depending on how that trauma manifests in that child, beyond even the angle of obesity, you need to handle that trauma. And first of all, see if it meets criteria for something like PTSD, for instance. Because if it does, they will persistently feel unsafe no matter where they are. And they will persistently have that mentality. And I love that you called it a mentality, because that's exactly what it is.
Yeah.
So let me just outline the premise on which CBT stands. So the premise is this, that our experiences in life lead to us seeing ourselves in certain ways. So giving the example you gave, this child has been exposed to poverty. So the belief that she might have about herself is, maybe food is scarce. When I see food, I eat as much as I can because I don't know when I'll see food again. So these beliefs, of course, they are not facts because things have changed, but these beliefs are what worked at that time as a child. Unfortunately, as the child grew up and became an adult, beliefs did not change even though the circumstance changed. So beliefs are like the bottom of a mountain. It's difficult to change them. Even though intellectually you might know that, of course, I have money, but, so where I'm getting to is that it will need more than convincing and talking to yourself. You need to teach this person to learn to identify this belief, and through something called cognitive restructuring, begin to change that belief. So basically what it means, cognitive restructuring basically means to check it out and see if it's a fact. Is it realistic, or it's more like a negatively skewed belief as a result of the events that happen? So once you do this and they realize that this belief actually helped me at some point, but now it's no longer helpful, and this is what is the reality now, then once the belief changes, the feeling about food changes, and the behavior of eating changes as well.
Thank you so much, Dr. Anireto.
It's an advantage.
That you being big, bold, and beautiful is not good for your health, okay? Is this something that can be handled in terms of cognitive behavioral therapy? Is this something that we need to go into someone's psyche to tell them that, okay, you've got to fix this? What is your opinion on that?
So thank you for that excellent question. I'm going to address it in a way you might not expect. So body positivity, so just in case, just to reiterate what Dr. Adenuga has said, body positivity is when you have a positive body image no matter your body weight or shape. So you're big and you're accepting and you're good. You're not so big, you're accepting and you're good. So I'm going to look at it from this angle. The advantages of body positivity is that it shields you from low self-esteem, from body image dissatisfaction, which we know low self-esteem is a risk factor for depression. And we know that depression can lead to obesity. Yeah. So I'm trying to say that there's nothing wrong with being body positive. Go ahead and be body positive, but also be realistic. So I'm saying body positivity and the reality that. So accept yourself and work towards preventing these illnesses that a big size and obesity can cause. Because if we say, there's nothing, I'm not saying don't be body positive, because if you're not, it can lead you to the obesity that we're trying to prevent you from getting. What I'm saying is realize that there are real consequences to maintaining the shape. Accept who you are. Don't talk down on yourself. Be self-compassionate. Validate yourself, meaning saying based on this and this that's happening to me or whatever, it's understandable that I am this size. However, I am the driver of the journey of my life, with God and all these things. And I choose also to make healthy choices that would reduce my weight. So that's what I would say about that.
Yeah, so let me just add a little bit to that, it's quite tricky, and there are many causes of obesity, to be honest. Some of it very, very complex. Some people have PCOS, for example. Some have thyroid issues and many other hormonal imbalances. And nobody is saying that you're actually the fault of blaming you. Obesity is complex. But when you begin to have health issues, it's always better to seek the care of a doctor. And if it involves you losing weight to have better health, I think that is a very good trade-off. And then you were speaking about some of the effects of obesity, like low self-esteem, depression. And also, if you look at it in a cycle self, depression can cause obesity, okay, and obese people are depressed. So how do we break that cycle? Some people, they are depressed, they eat, they become obese, they become more depressed, they eat, so the obesity just continues. And some people, in fact, they are obese, their self-esteem is low, they want to hide in their room, and they are not going out again. I have
they are
patients,
becoming more obese.
Yes, who tell you that they can't go to social events. I have patients that have operated, they lose weight, and now their status, they're always posting new clothes and all of that. And these are true life stories. So how do we break that cycle of low self-esteem, obesity, then eating, obesity, low self-esteem, and that? How do we break that cycle?
So thank you again. So I think the first thing is this awareness that obesity is not more unidimensional. That, like Dr. Timi said, it is a multifactorial thing. It is not just about what you eat and, you know, energy, food intake versus energy expenditure. There are hormonal issues, there are psychological issues, there are metabolic issues, there are a lot of things. So I would say the way to tackle this is to handle obesity, you know, from all angles at once. So if you are going to see Dr. Dodiga, for example, you also bear in mind the psychological background. If you have to see him again, I'm sure he would also do some background tests to check your thyroid function and all the hormones that Dr. Kande has mentioned to make sure that we target everything. So that's what I would say. So it's a screening that anytime someone who is big comes to see, you know, a doctor who is aware. You know, doctors know their salt, right? So it would be, you'd be screened for these eating disorders and mood disorders, and you'd be screened in a comprehensive manner and treated that way. I think that way.
I wanted to go to Akunde, but you raised something now. Okay. Eating disorders. What eating disorders? I know they are common now. There's a lot of light on them in the Western world. All of that. There's no much awareness. People actually have eating disorders. Yeah. I have people that tell me that they have a breakdown. They just go and carry a bucket of ice cream and just binge eat and all of that. Yeah. What are the eating disorders associated with obesity? And I just wanted to just shed more light on it. I know it's a problem here. We can't deny it, but please shed more light on it.
All right. So thank you. So we have the bulimia nervosa. Of course, you might know the anorexia, but typically they are underweight. So that's why I didn't mention them. So let me explain the underlying mechanism behind this. So first of all, bulimia nervosa is an eating disorder where people binge. To binge means to eat uncontrollably and have that sense of loss of control over your eating, and you eat large quantities of food that normal, you know, average individuals would not eat within a short period of time. And then you feel disgusted with yourself and ashamed of yourself, and then you find a way to get it out and you induce vomiting or you take laxative to purge yourself. So the underlying problem with bulimia, as is the same for anorexia, is this idea, this belief, you know, so CBT is about mind and thoughts and emotions and stuff like that. So this belief that your self-worth is dependent on your weight and your body image and your ability to control it. So you see this social media, you know, pressure to look a certain way. Even in this country, you know, a lot of times you see when you're trying, like in my clinic as a family doctor, when you're trying to get people to lose weight, they be like, doctor, I'm okay the way I am. I don't want to be slimmer than this. People think I'm suffering. So I'm like, the people that think you're suffering are ignorant. I'm talking purely from a medical perspective.
Thank you.
So what I'm saying is the underlying reason why these eating disorders develop, especially bulimia. I'll talk about binge eating disorder in a minute. So bulimia is that people believe that self-worth is dependent on body image, body weight, and their ability to control it. So they have these rigid rules where they put themselves on a rigid diet. And because the diet is so restrictive, inevitably they will fall short and, you know, not be able to stick to it. And then they binge. And because they had the belief that, you know, I can't control my eating, I must be worthless, and all those negative attitudes, then they want to get rid of the food. So it's a cycle that just keeps going around. And the thing about bulimia is these people can be average weight, like normal weight, or they can be overweight. So they tend to fly below the radar. We don't even screen for them as much because, you know, we don't, especially if they're not overweight. You know, so they do these things, and so that's the problem on the line. Then binge eating disorder is where you don't necessarily purge or take induce vomiting to get rid of the weight, but you just don't have that sense of control over your eating.
Please just tell us how CBT works. If an obese person comes to you now, what is your role in the management? Because there's a role for psychotherapy, CBT, and all of that. But what exactly do you do? How do you tackle the mindset of an obese person to shift them away from maybe emotional eating, from all these triggers and all of that? What do you do?
Okay, so thank you again. So what I would do, first of all, so an initial evaluation is what I do from the beginning for every patient. So that initial evaluation is me trying to understand that life history of theirs. and see, what led up to the emotional eating in the first place. And then identify those core beliefs. We call them core beliefs, very fundamental beliefs about themselves, intermediate beliefs, not so deeply held onto, and then the automatic thoughts, which are the things that come into their mind when they are faced with a situation where they need to eat. So once you identify those beliefs, remember they're beliefs, they're not necessarily facts. I teach them, I do it myself, and then I teach them how to look at these thoughts, first of all, to question them, and not to, just because you think them, you believe that they're true, because a lot of us think that, it comes from me, it must be a fact. No. A lot of things we think are, skewed negatively and not necessarily realistic. So I teach them to question their thoughts. I teach them to evaluate their thoughts, which means check it out. Is it a fact or is it more of an opinion? So after this, apart from this skill, I also teach them how to manage their eating. So it's amazing because CBT, can be amenable to weight loss. So I'll give you some, strategies I tell my patients. So number one, identify the goals you have for weight loss. What is it that you will achieve once you lose weight? Is there maybe some outfit you fit into? Is there some activity that you haven't done that you will now be able to do as a result of losing weight? Or is it purely because of your health, as we've been discussing? So whatever your goal for weight loss, put that always at the forefront of your mind. I actually have them imagine it. So the imagination is very powerful, even more powerful than the thoughts you have. When you think in pictures, it holds more true to you than the word. So put that into a picture. Put that picture where you see it every day. It will be like, the prize, and it will be you running for the prize. Next thing I would say is eat slowly. Savor your food. Don't eat when you're engaged in a very interesting conversation with someone, because then you eat and you're not mindful that you're eating. So eat slowly, savor your food. The next thing I would say is identify, when we're identifying those thoughts that led to the emotional eating, respond to them, and then have this response, response card, go through it every day. For example, the one I told you of, I've been stressed, I deserve an extra slice of cake. It's been a hard day. Plus, I've blown my diet. Might as well.
Yeah,
and then you splurge.
Yeah.
And this idea of this diet is too difficult. Not only me
yes,
we suffer for this world. Those kind of thoughts give you permission. Exactly. Now you're talking. So respond to those thoughts. For example, when this common one of I've blown my diet, that I'm no longer on the diet, I might as well. I use this analogy. I say, okay, so because you ate this and that you ought not to have eaten as per your diet, so you decided to blow it. I'm like, yeah, there's no point. So I'll give the analogy. I say, if you are walking down the stairs and you miss your step, do you now throw yourself down the staircase? Yeah, right. You will just take the step, the next step, and keep going. So just because you've made a mistake in your diet, it doesn't mean it's ruined. It's, in fact, a mistake in your diet is an opportunity for us to fine-tune these strategies, to adapt them to you, and even make them more powerful going forward. Another thing I like to do is I teach people to think of what is worthwhile about losing weight. For example, during the times when you did have control over your eating, how did it feel? How did you praise yourself? The
new clothes you could wear, the compliments people were giving you.
Exactly. So that would get you moving when the going gets tough. Another thing I like to remind them, because some people are really scared of hunger pangs. They imagine that, I'm weak, I can't resist food. When the hunger pangs are there, I'll just...
the common one I even get, I have ulcer. So because someone told you have, and they don't have, many people, they don't have ulcer.
Yeah.
So you begin to eat, say ulcer is coming. There's no ulcer anywhere.
Protect yourself from the ulcer pain. Right. So I teach them a small experiment. So if when you have severe hunger pangs or severe discomfort is like surgery, for anybody who has had surgery, if I hadn't had surgery, then maybe broken a bone, that's severe discomfort, right? Then moderate discomfort might be maybe a migraine. Then low discomfort might be maybe some mild stomach pain. Where would you rate hunger pangs? So most people will say, oh, it's mild, it's not that bad. So when the hunger pangs come, try and don't eat and see whether it ever progresses to moderate or severe. A lot of times it never does. And a lot of times it goes to a peak and then it disappears, especially when you focus your mind on something else. So the hunger pangs will not kill you. Definitely. As long as, there's this feeling of wanting to prevent, the hunger is terrible to give me this and that and that. So that's something else I do. Then finally, I remind them that staying away from not eating as per your diet and consistently acting according to your diet is like a muscle. And every time you work in the service of this diet, you build that muscle. So even though it might look as though, are you the only one suffering and all that, you're actually, increasing the likelihood that you will not eat this thing next time. And the more you do it, the easier it is. And if you should make a mistake in your diet, give yourself credit for the times you've stood up, handled the diet, and then talk to yourself compassionately. Nobody kicks someone who's already down. Rather, you encourage and you're like, oh, we can try again tomorrow. Yeah. So these are some strategies that you can adopt that would help you to stick to your diet and then do other things.
Right. Like you said, if you make a mistake, most people don't get into like eating 2 shawarmas in a day. What happens is that there's just a limit to what the body can absorb. Even if you eat 10 shawarmas, you eat 10,000 calories, your body will still dump most of it. It is when it becomes long-term, consistent, that is when the weight gain happens. And last but not the least, Dr. Anireto, is, you see, CBT is like an established way of taking care of people with obesity. We've patronized you like a few times, especially for people who have weight regain. What problem do you see in your field that you think is limiting the public acceptance of this? Why are you not really like having a crowd of people coming to you, obese people coming to you? Because obviously sometimes even if you do bariatric surgery from people, and I tell people bariatric surgery is not a magic bullet, people do bariatric surgery and still regain the weight. If one does not tackle the fundamental problem, for example emotional eating, childhood trauma, the weight is going to be just a matter of time. So what in your own opinion do you feel as to the slow uptake of CBT in the management of bariatric patients?
Excellent question, and thank you. So people don't believe CBT works. People say, does it work? I've had a discussion with the doctor and like, does it really tell me, like between the two of us, tell me, does it work?
Not using a knife to cut into your brain.
So I think it's just the not understanding what it's all about. And even if it works, how does it work? How is it that talking to people, you would get them to, maybe not kill themselves for those that are suicidal, or you reduce this terrible mood for those that are depressed or anxiety. So let me answer those questions. So the ways antidepressants and drugs for anxiety work is the same thing CBT does in the brain of those that go to therapy. It increases the level of these hormones that are low, serotonin and dopamine. That's exactly what CBT does. In fact, CBT is the first line now for some anxiety disorders, especially things like panic disorder. How it works is that so if you are anxious, your emotions are high, and when your emotions are high, your ability to reason logically reduces and your thinking becomes more extreme. So having a conversation, if the person is intentionally emotional, of course you have to use techniques to help the person to regulate themselves before you start doing the techniques, the cognitive techniques. But once you've done that, so I'm not arguing with you, I'm not trying to convince you in therapy. We're basically on the same side. I'm guiding you. So there's a concept called guided discovery. I'm showing you, another way to look at it. So I'm laying the options in front of you and saying, in a questioning way. So I'm saying, what do you think would happen if you kept, for example, if you kept on thinking about ending your life? What are the downsides of this? Or what are the advantages? And then if you allow me to use an example of suicide, people would say, the pain would stop. I would leave this world. I'll be at peace. And then I would say, but what if I told you that there's a way you can be at peace and have the pain stop and still be able to achieve your goals because you're still alive? And they're like, oh, really? And I'm like, oh, that's what this is all about. So that is the approach of CBT. It's not persuasion. It's not reassurance. Even though reassurance would come, it's me showing you another way of seeing things. I hope I answered that.
Yes, you did. Dr. Anireto, any last opinion, last words on the impact of obesity on the mind? Anything you want to tell us?
Oh, I would say don't underestimate the power of your mind when it comes to, your weight. But even in spite of that, there is a role for other options like the surgery and exercise and other things. So obesity is a multifactorial problem. We all now know that it's gone way beyond eating and exercise. There's so many other factors, including your mind, other mental illnesses, thyroid problems and all that. So obesity should be addressed in that way and not just like a purely. So that's what I would say.
Thank you so much.